I'm Commissioner Raquel Regalado, and thank you for spending your lunch break with us. As a former school board member, I love ed, and there's so many great things about our government that we want to educate you about before it's a problem. So this is a series where we deep dive into all things Miami-Dade County, bring along our partners, and share some knowledge and some opportunities with you.
Hi, good afternoon, and thank you for joining us. My name is Tiffany Emerick. I am a licensed psychologist in the state of Florida, and I have the pleasure of introducing you to Julio Martin, a current doctoral intern here with us in Miami-Dade County. Julio, you want to say a little something about yourself?
Sure. Good afternoon. It's great to be here. I'm excited to do this webinar for our community. And like Dr. Amrit shared, I'm a doctoral intern completing my PhD in the University of Florida, and really happy to be an intern down here with the Community Services Department.
Beautiful, beautiful. And we want to thank District 7 for asking us to provide this presentation. We are really committed to mental health, and we wanted to talk a little bit today about mental health, really share some resources with you that we hope will be beneficial, and talk about well being overall. So, thank you again. Great. So, a good place to start is talking about mental health, what mental health is. And we'd like to break down, we're really focusing on three areas here. When we talk about emotional well being, that's really our ability to acknowledge our feelings, to handle our emotions, the difficult emotions, the big emotions, stress, and positive emotions. So that's what we really mean by emotional well being. And then we focus on psychological well being. And those are our thoughts and our beliefs and how we believe we're kind of showing up in the world and how we're functioning. And then we talk about our social well being. And that's really looking at our social interactions, family, friends, how we interact with others, the depth of these interactions, and the meaning that they bring to us. So that's really what we're talking about when we focus on mental health. We often hear about mental illness. And when we're talking about mental illness, we're talking about diagnosable conditions, things like anxiety, depression, post traumatic stress. And so we really want to emphasize today that mental illness can affect anyone. In fact, when we look at statistics from the CDC, the Centers for Disease Control, 1 in 5 Americans experience a mental illness each year. And if we look at our lifetime, what we call a lifetime prevalence, if we look at ourselves, that there is a 40 to 50% of us will experience in our lifetime a mental illness. And we also want, so we really want to look at this as this is a situation that many of us experience. So we want to normalize that and encourage people to reach out for help. So we wanted to make those distinctions mental health, and then when we're talking about it going into the area of a mental illness. And this can change over time based on what we might be experiencing in our life. Thank you, Julio. Next slide. Great. So when we talk about mental health providers, often refer to something called the Diagnostic and Statistical Manual of Mental Disorders. And just wanted to read this quote, and what you're going to see emphasized here in yellow on the screen is something we really want to focus on. But when we look at the definition from the DSM-5, so where clinicians are consulting, our licensed mental health counselors, our social workers, psychiatrists, psychologists, it is defined in the DSM-5 TR as a syndrome characterized by clinically significant disturbance in an individual's cognition, emotion regulation, or behavior that reflects the dysfunction in the psychological, biological, or developmental processes underlying mental functioning. And this is the area that we want to emphasize, that mental disorders are associated with significant distress or disability in our social, occupational, or other important activities. So you can be experiencing some symptoms, but it is not to the degree that is impacting your functioning, how you're showing up in the world, how you're showing up at work, how you're showing up in your relationships. So we're talking about a significant impairment that the individual is experiencing. Thank you, Julio. Next slide. So, as we're saying, we're really looking at our health here on a continuum. So, when we talk about healthy, normal functioning, this might be our baseline functioning. We're feeling that we're showing up and we're going through our responsibilities. We're able to manage our emotions. We feel that our thoughts are in a healthy spot. And then on a continuum, we can experience maybe mild symptoms, moderate impairment, or maybe really severe impairment. And if you notice here on the screen, we really have a, a shading. There's no distinct area and category in our life, but it is a continuum. So you'll see the shading of the colors going from green, where we feel that we're in a healthy functioning spot, and then going all the way to red, where we might be experiencing really severe impairment, something that is persisting in our life. And at this point, we might be experiencing a mental disorder like depression, anxiety, or post traumatic stress. There are many, many disorders. These are just some. But Julio and I today wanted to emphasize this continuum and normalize that process. Thank you, Julio. When we talk about our mental well being, it's really important to look at risks that we might experience in our life. And there is a myriad of risk factors. But Julio and I were intentional about identifying a couple. Maybe family separation, someone who feels very alienated from their family can be a risk factor for their well being. Trauma in one's life, experienced either through their occupation, their childhood, in adulthood, trauma can be a risk factor. Also, one's migration status. We are a melting pot here in South Florida, and we have a lot of individuals who have migrated from their home countries and have experienced much stress in that journey and that process and getting acclimated to a new culture. Also, social isolation. We have a U.S. Surgeon General who has identified loneliness as a national pandemic. So many of us feel isolated from others and then experience feelings like loneliness. So that can be a risk factor to our mental well being. And also economic hardship. The economy can affect us if one feels that they're struggling just to pay the bills or they're not able to cover the bills. This economic hardship can be a risk factor for our well being. Thank you, Julio. And then protective factors. There's a lot of things in our life that can um, help us navigate and protect us. And one of those things being a strong family connection. So, making those efforts, connecting with family, seeing family, turning to family for support. Faith and spirituality are also risk factors. People lean into their faith or spirituality, especially maybe during difficult times. So, acts of prayer or meditation can bring calmness to helping us cope with factors in our life or stressors. And it can also bring meaning to our life, this kind of meaning making process, which is a protective factor. Cultural traditions. We have so many cultural traditions and a myriad of cultures here in South Florida. And some of these traditions, again, coming together with an emphasis on family, maybe storytelling, passing down history, these are some cultural traditions that can help people feel connected and supportive. And then that ties into the last one we have listed here, which is community support. That mentality of kind of we versus I, where people feel that there are those in the community that can come alongside and provide support. Thank you.
Okay, thank you, Dr. Amrich. Thank you for that foundational understanding of mental health and mental well-being, and also normalizing the fact that we can all find ourselves on this continuum, right? And so, again, those risk and protective factors can help us either find ourselves more vulnerable or helping ourselves find that wellness and that well-being. And so this slide also emphasizes that we have a very diverse community, and so mental well-being and mental health may look very different across diverse populations. And so, for example, we know from research that Latinx populations tend to their mental health difficulties tend to manifest in more so of somatic symptoms. So, for example, you may have a Latinx individual who is experiencing mental health difficulties, and it may be showing up for them as headaches or migraines or stomach aches. And they may be describing it as nervios or nervousness and exhaustion. And so, uh, we need to be attentive to the fact that mental health looks differently across cultures and diverse populations. We also know that migration experiences can affect well-being. And so, like Dr. Amrich mentioned, one of those risk factors are family separation. When we have individuals that are removed from their social networks where they find resources for well-being, they tend to be more vulnerable and experience more difficulties. The migration experience can also be very stressful as an individual or a family is acculturating to the new culture, learning a new language, a new community. And so there are a lot of different aspects of migration that bring a lot of distress to our community. And of course, we know we have a very large migration community here in Miami-Dade. And then also stigma may prevent help-seeking behaviors. For example, I will say again from Latinx communities because this is the bulk of my research, but we know that a lot of Latinx communities may seek help from a primary care provider before they go to a psychologist or before they go to a mental health counselor. And so we know that there's stigma and there's shame around seeking services about mental health difficulties, even though we know that all of us experience mental health difficulties at some point. And so what are the challenges, right? Like, what are the challenges in our community that are preventing people from seeking services? Well, as I mentioned, we know that we have a very large immigrant community. And so I believe about 25% of Miami-Dade County are monolingual Spanish speakers. And there's about 70% of our community speak Spanish at home, even though they may have various levels of English proficiency. And so we need to put out resources that are accessible in different languages. So, for example, our department puts out resources in Spanish and Creole and other languages that are accessible to diverse populations. We also know that documentation concerns could be one of those challenges that our community members face when seeking services. However, a lot of our community members don't know that we do have places that they can find help. For example, New Direction Residential Treatment Program, which we'll talk about later, which community members can come and they don't need to have a photo ID, they don't need to have insurance, and they receive services that they need. And so this is another important challenge to address in our community. Also, financial stress and housing instability. This is another of those risk factors. And so, for example, out of the 796,000 people that were seeking or needed mental health services, they cited that cost of services was the main reason that they did not get the services. And so we know that this is a big issue in our community, um, and also limited access to affordable care. So again, a lot of our community members don't have insurance. So about 17% or almost 18% of our community members are uninsured. And about one mental health there there's about one mental health provider for 498 people. And so, again, when we think about that with, for example, language barriers, how many of those mental health providers can offer services in Spanish? And then how many of these community members have the resources to access that mental health provider? And this is where we find those challenges with our community. Something really interesting that Dr. Amrich and I came across as we put together this webinar is some research from last year, where, according to Google, search trends around mental health issues in Miami are at a recent all-time high. And so we know that people in our community are looking for services. They're looking to understand mental health and what that means. And in 2022, about 17% of adults in Miami reported having poor mental health for at least 14 days. And so these statistics may be somewhat correlated, where we have community members that are experiencing mental health difficulties. They're getting online, they're going on Google, and they're looking for services. They're looking to understand how they can best support themselves. And so this is where we can come in with resources and with services to help these members of our community.
Julio,
And so,
I think that's
sure.
such a great point. The Google search, we were really struck
Hmm.
by that, right?
Right.
And,
Yeah.
part of our discussion was, people are looking for it. And are people becoming more informed? Is there greater awareness out there of
Mhm.
mental health needs and resources? It's Mental Health Awareness Month right now. Miami-Dade
Mhm.
County has a campaign that has been kicked off called No Shame, Let's Talk. So I would like to think in part of these searches that we're getting the news out there. Again, Julio, you were talking about
Mhm.
stigma, that people understand it's okay not to be okay. It's okay to ask for help and are being proactive or asking for help and seeking the resources. So, thank you for
Mhm.
emphasizing this information, Julio.
Yeah, absolutely. Thank you, Dr. Amrich. It's so great that we have this campaign. We want to help our community members come get the resources you need because they're here for you. And so that's really important. Um, And so this was another statistics, some other statistics that we came across, and we thought were very relevant to understand our community members and their struggles. And so this is specific to Miami-Dade County. It's from the 2023-2024 year, and provided by the CDC, in where we find indicators within our community of different difficulties. And so here, circled in red, we see that depression, there's about a 14% indication of these difficulties in our community. Frequent mental health or mental distress, also almost 15%. Again, that uninsured number of community members, about 25%. And we also were looking at these other indicators, and we were talking about how, you know, these indicators of diabetes, obesity, heart disease, stroke, high blood pressure are not completely isolated from mental health difficulties. And so we know that a lot of these difficulties are in part due to stress, and can create stress, additional health stress for individuals and community members. Um, and so we know that there's, even with the approach of um, treating people that are not severely on that spectrum of mental health difficulties, but are somewhat on that continuum, can really benefit uh, from the stress tolerance and getting resources that can help them with these other areas of their life as well.
Thank you, Julio. So, Julio and I have the pleasure of working for Miami-Dade County, the Community Services Department. And we just wanted to share we're the Social Services Department in Miami-Dade County, and we serve across the lifespan. So, we have a program called Head Start, Early Head Start. This is a federal program serving 0 to 5 kiddos all the way through older adulthood. And so we are a resource for you all in Miami-Dade County. And we know there's a lot here on the screen, but we wanted to emphasize that we have these various divisions that come together to collaborate to help the individual's family, and serve the whole family. So, for instance, you might be in need of utility assistance. We have a division, the Family and Community Services Division. One might be in need of services for their adolescent um, child who is experiencing difficulty. We have juvenile services. So, we're going to be going through in the next couple of slides some of our divisions where we have a clinical focus that we wanted to share this information. And we're also happy to pass on this PowerPoint so you can access the PowerPoint and any of the resources. So that's something that we can share. Thank you, Julio. So, as I said, we're going to talk about some of the services within the Community Services Department that have a clinical emphasis. So, you might be listening today and you're thinking about yourself or a loved one or someone in your community. So, as I referenced, we have Head Start, Early Head Start, which is a federal program. And the aim is to do just that, give children a head start and preparing them as they enter kindergarten. And just some of the services you'll see here on the screen, health and nutrition needs of the child are addressed. There's developmental screenings that children have. Maybe there's a vision problem, maybe there's hearing difficulties. So these screenings happen as well as developmentally to see where children are when we look at what are called their developmental milestones to make sure they're progressing well. In the program, children are getting a breakfast, lunch, and a snack. And these meals are overseen by licensed dietitians, so we know that they're healthy and balanced meals. And then there's a focus on parent engagement, and really incorporating the family, helping them in any way possible to promote the health of their child and the health of the family. Thank you, Julio. And just briefly, we wanted to share with you this emphasis on social emotional development, starting at a very young age for our children here in Head Start and Early Head Start. So they follow something called the pyramid model. And what we wanted to emphasize here is if you look at the areas here in blue, there is an emphasis on looking at providing both nurturing and responsive relationships. So, in this setting, we're looking at the relationships between teacher and teacher aide, children to children, teacher to children. So, modeling these healthy, and I really like that word, responsive relationships, individualizing responses to the needs and the temperament of the children. We're providing a supportive environment, and we're targeting the social emotional development for all the children. But in our circumstances, there are some children that, despite the bottom part there of the pyramid model, they might need additional support. And that's where they come to the attention of providers. And in our case, they come to the attention of interns and practicum students. So we're able to go in and assist and assess the situation. And so that's the intensive intervention that we might be providing for these children. And I think Julio's going to talk to you about a particular case, right, Julio?
Yes, thank you, Dr. Amrich. And so, I'll talk about one of my Head Start cases. This is a 4-year-old Hispanic male from Nicaragua. Him and his mother moved here, migrated here to Miami when he was about 1 years old. This is an immigrant family. They went through uh, a migration process, crossing boundaries, and a difficult journey for this family. They came to our attention because they were seeking services for disruptive behavior in the classroom that the child was exhibiting, and so. Something very important that we did with this family that very much represents a lot of the families that we see in Head Start here in Miami-Dade County is that we really contextualized the behavior of the child that we were seeing in the context of the family's experiences. So, for example, it was very clear to us that there were a lot of risk factors with this family. There was family separation, there was financial stress, um, single mom, not a lot of support system here in Miami. And so we came to understand that rather than an inherent uh, flaw or difficulty of the child, we contextualized his behaviors with all these factors. And so we understood that in order to help this family, we needed to support the family entirely. So support the child and the mother, but also come into the classroom and support the teachers, support the site entirely in supporting this family. And so, using that pyramid model that Dr. Amrich talked about, we really anchored our intervention in building this responsive and nurturing relationship for this child, not only with his teachers through trainings that I did with his teachers and parenting uh, intervention and practices that I helped with the mom, but we also extended outside of the classroom and we helped this family through advocacy, helping them get different resources that they needed to find stability, to for this child to experience safety. And so the moment we were able to do that for this family, we saw that these behaviors started to decrease. And we had, for example, the teacher of this child very much expressed how she saw the pyramid model come to life, and how she noticed that that nurturing and responsive relationship was creating the safety that this child and his mother needed, to thrive, to do well, to be able to get to the classroom and learn. And so we were able to do all of this through our Head Start program, through our community services department. Um, and I'm a huge fan of Head Start, and it's such an amazing program for all of our families, not only here in Miami-Dade, but across the nation. I don't know, Dr. Amich, if you want to jump in and
Julio,
say
that's
anything
just
else.
such a wonderful demonstration of the work done. Our Head Start, Early Head Start, is the largest program in the Southeast. We're what's called the grantee, overseeing private delegate agencies. But you know, Julio, when I think of this child and the family, knowing that there were so many layers of coming alongside and helping the child, you working very closely with the teaching staff. You know, because sometimes we can all go to trainings, right, and hear information, but sometimes it needs to be broken down to make sense to us, right? Or to experience it, because sometimes it can just be words. So, for you kind of sharing that interaction with the teacher, breaking things down, and it, like you said, coming to life for the teacher, and then enhancing relationships is improving the well-being of everyone, the teacher, the
Exactly.
child, the mom. It's just
Exactly, Dr.
really
Amich.
a, a delight watching you work with this family. And I love the advocacy piece, right? Because
Mhm.
sometimes we lose sight. If we think back to basic needs, it's hard to be focusing on something else when your basic needs are not being met, right? So that
Exactly.
advocacy piece is so big.
Yeah. And that's why we're here, right? That's why we do what we do, to help our community members. Um, so I'll pass it
Excellent.
back to you, Dr. Amich.
Okay, Julio. So I made mention earlier, we have a juvenile services division where we offer clinical support to our juvenile assessment center, commonly referred to as the JAC. This is on site support for youth who are currently presenting in crisis. That crisis might reach the risk of maybe even having suicidal thoughts or intent. So we have clinical staff working very closely with the youth, the juveniles, with their families, providing brief interventions to make sure they're safe and stabilized, and then do a warm handoff and connections to mental health services that the child might benefit from, or the youth, excuse me, and their family members. But that is referred to as our JAC program, the Juvenile Assessment Center. Thank you, Julio. Next slide. And then there we also have diversion services for our youth. And here, this is a goal of prevention and diverting from the criminal justice system. And so here we are individualizing the care that our youth are receiving. So they have individualized care plans focusing on their needs, and you have a team coming from different backgrounds, different disciplines to work collaboratively to address the needs of the youth, these high risk factors, and the needs of the family. And again, providing connection to resources. Thank you, Julio. We have our Violence Prevention and Intervention Division. And here, this division is providing support for domestic violence survivors, survivors of human trafficking experiences. And in this division, we are providing both residential and non residential support. Our residential, we have 3 domestic violence shelters, and we have what is called transitional housing. So this is longer term stay, and this is an opportunity where in our transitional housing, women can be with their children and seeking employment or working jobs, but in a safe haven. And specifically wanted to mention, some of you in the community might hear of this site called CVAC, which is our Coordinated Victims Assistance Center. And this is a center where an individual can come in and through an intake process, their needs are identified. They're able to state what they need, or in meeting with an advocate, the advocate might identify needs that someone might need experiencing domestic violence, human trafficking, stalking. And at our CVAC, an individual has an advocate. They can receive assistance with what are called restraining orders or orders of protection. They can get legal support, assisting going into court concerning restraining orders, or also helping with immigration processes and psychological support. We have an intern that is there each year who provides psychological support. And CVAC also has relationships with other providers in the community. Thank you, Julio. So I just wanted to talk briefly about a young woman who sought services at CVAC. She's a 25-year-old Hispanic female from Honduras, and she has been a victim of domestic violence since 2023. She is a mother of 2 young children, and she sought services at CVAC due to domestic violence experiences. And what she reported is that she wanted help addressing her self esteem and looking at relationship patterns. And so she's working with one of our interns and really looking at the issues of power and control that have been in her life and helping her identify these behaviors. But first and foremost, looking at the safety of her and her children and creating that psychological safety to come into therapy and talk about trauma that she has experienced. And much like the child that Julio spoke about at Head Start, where we're working with the family, this client had shared that children had witnessed domestic violence. So part of our involvement then as mandated reporters protecting vulnerable children was working with the mom, where we made a report to Department of Children and Families. So we're working with the mom. The mom is receiving support because we want to ensure the safety of children who are often victims of domestic violence, maybe trying to break up violence that's happening or witnessing violence and the trauma that can come from that. So here, our current intern is working very closely with her client to ensure the safety of her children and her safety. Thank you, Julio.
Thank you, Dr. Amrich. And I really appreciate this example and the fact that we also collaborate with the Department of Children and Families to find additional supports and additional resources for the families that we work with. Just how you mentioned in this slide, how you worked with the intern and this client and her children. I've also worked with Head Start cases where we needed to uh, make that call and have that collaboration where the Department then of Children and Families was able to provide parenting trainings and supports to our families, to again find them the resources and supports that they need. So I really appreciate that piece also.
Really well said. We also wanted to highlight we have an older adults and individuals with disabilities division. And in this division, we provide services that include adult daycare, home care services where we have aides coming out into the home to provide assistance to our older adults or young adults with disabilities. We have congregate meal sites where individuals can come for socialization and a balanced hot lunch. We have Meals on Wheels. These are frozen meals that come to individuals' homes that have been determined to be what we consider homebound. They're not able to engage and go out into the community and attend a congregate meal site or an adult daycare site. And we also have volunteer services where we have individuals who volunteer across our programs in the Head Start programs as well with our children. And in particular, in this adult daycare setting, individuals can come where there are nursing services provided. There is recreational stimulation provided. There are aides who are providing assistance with their what we call activities of daily living, maybe assisting them in the restroom. And also having our older adults interface and interact in the community. So they go on field trips and enjoy each other and learn from events in the community. But specifically, we're providing psychological services in the adult daycare setting. And here we're often encountering individuals who are really dealing with issues that come from transitions in life, these role transitions, maybe individuals who are struggling with no longer working, or they are having difficulty accepting maybe physical changes that their body has experienced or psychological changes that they are going through. We've had a lot of older adults sharing transition that they're going through, that they might be more dependent now in their current status and the difficulty that comes with that. Or, to be honest, difficulty living with their children. Again, and dealing with that transition, right?
Mhm.
And family trying to help, but maybe sometimes it doesn't feel so helpful, or they are trying to maintain independence, but we are there providing and coming alongside services where individuals might be dealing with some of these struggles to provide therapy. Family therapy is also provided if a client would like that. So we just wanted to touch on that, and that is specific right now to the adult daycare settings.
Thank you, Dr.
You're
Amrich.
welcome.
And so we also have the rehabilitative services division. And so within this division, we have the central intake, which pretty much is an entry point for community members that are seeking services. And so they may be assessed by the professionals working central intake and then provided direction to where they should go in the community for the services they need. And so, for example, one of those services may be outpatient services. Outpatient services are for those individuals that do not require to stay in an inpatient facility, but can go back home and or back to where they're staying for housing and come out to these community centers for services. Then we also have New Direction, which is the residential treatment program. And I have the great pleasure of completing my adult rotation at New Direction. And so what we do various things at New Direction, but specifically us within the psychological division, we come into New Direction and we provide individual and group therapy, and we also provide psychological testing and support the counselors that work there in case management and really anything that these participants and community members need when they step in through the doors a new direction. Specifically, this center is for community members that have substance use difficulties and substance use disorders. Of course, we tend to see a lot of intersection between substance use disorders and mental health difficulties. And so here we really come to provide these members that a lot of times are unhoused, have experienced complex traumas, and are really struggling. These are community members that are very vulnerable and really need our support and professional help. And so, um, for example, we do some group therapy services. For example, I do one called Seeking Safety, where we help our participants understand the impact of trauma on their nervous system and help them understand how some behaviors may be stemming from these traumas and helping them really find new direction, helping them rediscover themselves, reinvent themselves, um, to fight addiction and to overcome it. And so it's a great place for the community, and I'm very happy to be a New Direction and see.
Thank you, Julio. Excellent. So we have shared with you some of the clinical resources within Miami-Dade County's Community Services Department, our department. But we really also want to share with you there are many resources in the community. But what we often hear is, oh, it's really difficult to navigate the system. And so we really wanted to start with, first of all, to know for everyone to know that there is this 211 resource here in Miami. And this is free. It operates 24/7 and it's a helpline serving Miami-Dade and Monroe counties. And you can phone 211 and receive assistance helping you to navigate resources. It might be legal aid, healthcare, psychological services, crisis counseling, um, the need for food, shelter, mental health referrals. So, this is a must have to remember 211. You can access resources, get a list of resources that you can then phone and see if they can be of assistance to you. So, we want to start with 211 for everyone. And also 988. I'm not sure if everyone is aware, this 988 number was launched back in 2022, where you can call 24/7, free, confidential. If you're struggling, it doesn't have to be to a point where it is rise to a situation of feeling, of having suicidal thoughts. Um, but you can reach out for support and connection. But this is known as the 988 Suicide and Crisis Lifeline. So 988, easier to remember, right? It used to be a longer number. And again, this was launched to make it more readily available. There's also a mobile response team called WestCare. And again, we're happy to share this PowerPoint. But this is a mobile crisis response that is just that. There are licensed clinicians that will come out, assess the situation to see if someone, what level of support they might need. It could be some reassurance, or it could reach a point where maybe someone actually needs to be hospitalized to keep them safe. but this is a mobile response team. And then we also wanted to share, some of you might have heard NAMI. This is the National Alliance on Mental Illness. And these are free services. And what I find really helpful is that NAMI, it is throughout the United States, specifically my NAMI Miami-Dade chapter, does provide free peer support groups. So it is not individualized therapy, but it's an opportunity to experience support amongst peers of individuals maybe going through the same thing or struggling with some of the same situations. So those support groups are free. Thank you, Julio. And we want to kind of end, we're aware we probably have about 8 minutes left, but we wanted to go
Mhm.
into some well being practices. Right, Julio?
Yes, very important. And
Excellent.
go
You've
ahead,
got
Dr.
it. You've
Amrich.
got it, Julio. You've got it.
So, again, we know that, we are creatures of habit, and routines keep us organized and they keep us structured. And so it's something to keep in mind. What is my routine to maintain my well-being, right? Am I getting enough water? Am I drinking enough water? Am I doing enough movement in my day? Am I connecting with a loved one, right? Maybe this is a checkpoint to check in with ourselves. When was the last time I reached out and connected with a family member or a loved one? And these are those protective factors that can help us on that functioning of that continuum. We also want to maintain our cultural, spiritual, and religious practices, practicing mindfulness, meditation, prayer, or any connection with higher power and spirituality that brings us well-being. Again, we also want to seek help early. We know from research that early intervention has the best outcomes. And so, if things are not feeling right, listen to your body, listen to your mind, listen to your heart, to your emotions, and look for help. We're here to support through our department, with through all these different areas that we provide services, and so we're a community, right? We need to be there
Mhm.
for each other. Um, we also wanted to bring in this dimensions of self-care. This is actually something that we have been utilizing internally in our weekly meetings as a checkpoint, for us to check in with ourselves. How are we doing in these different aspects and in these different dimensions of health? And really, the emphasis is that we create balance and relationship between them. And so, all of these fears are connected. And so maybe we need to check in with our physical self-care, because we know that that impacts our emotional self-care, and our mental self-care. We know that spirituality and social life can also influence how well we are feeling and how well we are doing. And so um, we're doing it, and we find the benefit in doing these checkpoints. So we really encourage our community members to check in with themselves and with their loved ones and their neighbors and community members, um, to see how they're doing, right? And so we can uplift each other, and experience wellness as a collective in here in our community.
Excellent. And really, just in closing and reflection, Julio, and I just wanted to kind of end with a couple areas of emphasis. So, we really talked a lot about this, right, Julio? That mental health is part of our overall health. People seem more comfortable maybe talking about their physical health, that our mental health is part of our health. And Julio was talking about that interconnection, right? It's hard to have great physical health if mentally you're not feeling well or you're struggling, and vice versa. So, mental health is part of our health. We want to leave you with knowing that there are resources that exist in Miami-Dade County. Um, it might take some energy and navigating, and that's where we talk about having friends, family reaching out to maybe help in navigating the system, right? And really emphasizing that culture and community are strengths. Julio, I've heard you say community so many times throughout this presentation, and we are a community. We have our communities with families, with our communities around us, the bigger collective community. So we are here to help. We encourage you to come alongside of those who might need help and to encourage those to seek help. As we said, this month is mental health awareness, and the campaign being launched is No Shame, Let's Talk,
Mhm.
right?
Let's talk.
Let's
Yep.
talk. And Julio, I really enjoyed uh, working with you and preparing this presentation. And the community is lucky to have you as a soon to be psychologist out there. So thank you for your work, and thank you District 7 for reaching out and asking us to speak to you all about mental health, mental well-being. Julio, you want to close with anything?
Well said, Dr. Amrich. Thank you for your leadership and support, and thank you, District 7, for this invitation for us to share with our community all the resources that we have, and hopefully it has been helpful and informative. So thank you all.
Great. Be well, everyone.